Yeah, so cryobiopsy or cryosurgery is a very recent advancement in pulmonology. So what we do is basically we are doing minimal access surgery. So to get a diagnosis or at times even to cure a disease, we tend to target certain areas of the lung, for which we use something called as a bronchoscope, which goes inside your body through the nose or the mouth, and along with the bronchoscope goes a cryoprobe. And this cryoprobe has a technology to freeze whatever it comes in contact with. So it freezes the target tissue and we can pull out the tissue right outside from the lung. The advantage here is that we are not going for any major surgery. What used to happen with a lung biopsy or a mediastinoscopy is that the thorax used to be opened. So now the same thing is done without giving any incision. We just go in through your mouth and we take a lung biopsy sample. This can be used for diagnosis of lung cancer. At the same time, if there is any tumor inside the airway, it can be actually extracted with the cryobiopsy. So in the past 5 years, cryobiopsy has become an important tool. The only limitation is that it is limited to few centers in the city because it requires a lot of expertise and a lot of advanced machinery. So there are very few cities in the country where this facility is available. So endobronchial ultrasound or the EBUS is what we consider the next best invention after the stethoscope in pulmonology. So this is a specialized bronchoscope which has an ultrasound probe at the distal end. So you can imagine there is an ultrasound machine which is often used for scanning the abdomen, especially during pregnancy. So a very smaller version of it, almost the size of your fingernail, is now attached to a bronchoscope. It goes inside your body through your mouth or the nose, and inside then we can scan certain nodes around your lungs which are often the predictors for lung cancer. In India, it can also predict something as basic as tuberculosis, but endobronchial ultrasound is another very advanced technology, fairly expensive machine which is used for various lung diagnosis. So a bronchoscopy is right now a very basic procedure. It's something which is a mandatory test either to look for lung cancer or the cause of pneumonia, or at times if somebody has aspirated a foreign body. So bronchoscopy is a base level basic investigation that is performed to look for any disease or to find the diagnosis. The endobronchial ultrasound is an advanced bronchoscopy wherein there is an ultrasound attached. So the endobronchial ultrasound is what you can say is a very level 4 or level 5 procedure compared to a bronchoscopy, which is a level 1 procedure. So interventional pulmonology is a subspecialty of pulmonology. So earlier what used to be just the basic science of lungs is now being divided into various subspecialties. There are a lot of doctors who are now focusing solely on allergies, some certain doctors who are focusing only on lung cancer. So interventional pulmonology is a subspecialty wherein certain highly advanced machines are used to enter your body and get a diagnosis or treat the lung pathology. So this again involves various modalities like cryobiopsy, endobronchial ultrasound, heat electrocautery, then APC, then navigational bronchoscopy, which is like a GPS, and then there's thoracoscopy. So interventional pulmonology is a new subspecialty which has been there for the past 10 years, and it is actually challenging the thoracic surgeon, because now earlier whatever used to require you to actually open up a patient's body is just done within a fraction of 15 to 20 minutes, and the patient can go back home on the very same day. So what has happened in the past course of 10 to 20 years is that these subspecialties have developed amongst the doctors, but we don't have enough centers for training doctors for these subspecialties. So I personally had to go to Italy for a training course, get myself trained in intervention, and then come back to India, which is not possible for each and every doctor to actually give out that much time and energy from their regular work. So these workshops, I believe, are very essential and very helpful for the budding pulmonologist and even the senior pulmonologists who wish to now learn these newer techniques of interventional pulmonology. So these workshops, I believe, will eventually bring a huge wave of change amongst the new doctors when they'll pick up new techniques and new skills at these workshops and eventually bring it for the betterment of the society. And Doctors Burnout is now a research identified clinical entity, which is basically doctors getting fatigued and tired because of working for a very long stretch without sufficient breaks, which has been right now exaggerated in the COVID-19 pandemic. So usually a doctor is trained to take care of his patients. Every doctor often keeps his patients' well-being before his own well-being. And what has happened during the COVID pandemic is a lot of doctors who were involved in the COVID-19 frontline workers were the ones who were working at days at stretch, nights at stretch, and essentially because of the restrictions that were brought around, there was no other way other to actually step out, meet other people. So doctors over the past 12 months to 24 months have now been experiencing a lot of depression, a lot of fatigue, a lot of tiredness, they are losing confidence, and a lot of doctors are now even contemplating to leave this field and maybe move to some other field. So this is all defined under doctor's burnout. There have been papers in 2015 and 2016 which define that a doctor who's been working for a very long time and is not exposed to his daily life routine is somebody who's now suffering from doctor's burnout. COVID-19 pandemic has also brought in another problem, that after the COVID-19 pandemic, doctors have to now go back to their routine, which is also taking a lot of time because healthcare has not completely recovered from the after effects of the pandemic. So if you have a doctor around you, quite possible that he or she might be anxious, he or she might be depressed, and such a person requires some special care for himself, for his family. We nowadays often recommend the doctors to be more self-aware, to be more self-conscious and put their health before anybody else's health. So these are all parts of doctor burnout, and we are still through the process of it. We'll get to know a lot about it maybe in the forthcoming years as and how the whole world recovers from the COVID-19 pandemic. So the COVID-19 pandemic brought a lot of focus on the lungs. So people always used to take their lungs for granted. There are two reasons for this. Lungs don't have pain receptors. Heart, on the contrary, is very sensitive to pain. So whenever you have a cardiac issue, you would grab it very quickly and you will rush to the hospital. Lungs, on the contrary, you can develop a very advanced lung disease, but you might not have the symptoms. Another problem is that you have two lungs. So you can always take your lungs for granted, and your lungs often take a lot of insult for a very long time before they actually show any disease. So a smoker needs to smoke for at least 20 years at a stretch to actually see the problems that come out of smoking. So because of this, people used to take their lungs for granted, but COVID has shifted the focus. Now people know that lungs are an essential part of the body. Lung evaluation right now will be considered in a general body checkup. A lot of hospitals are now investing in getting a pulmonologist, getting a lung function test. So people now are taking more cognizance towards their lungs. Pulmonology as a field has now come on the center stage because the need for pulmonologists had increased during COVID, because a lot of COVID patients were requiring care related to pneumonia, related to ventilators. So this branch eventually will now evolve in the coming years from the backstage to the front stage. And I believe that there has been a sea wave of change. People used to not follow what we call is a basic respiratory hygiene. While you're coughing, while you're sneezing, you need to cover your face, you need to cover your mouth. Social distancing is something that needs to be followed irrespective of COVID or not. You need to keep a safe distance. If you are unwell, if you have a flu, you should stay home. You should not go to work, or you should not send your school to child, eventually infecting other people. So these are certain practices of respiratory hygiene which have now become the norm. And I think so the mask might gonna be stay for a very long time, because masks are not only there for COVID, it is for the basic flu. Whenever you're coughing or sneezing, you can spread the infection. And air pollution is another pandemic which is already around us. So air pollution requires you to wear masks. A lot of countries like the Koreans and the Chinese have already been used to checking the AQI monitor and wearing a mask accordingly. So I believe now with COVID gone, people will give more importance to their lungs. Lung function test will be very essential to basically know if your lungs are performing well or not. And something like a respiratory hygiene, mask, sanitization and social distancing is going to stay with us for a very long time. So the complications of COVID-19 pandemic have been seen both on the physical front and the medical front. On the physical front, we are seeing what we call as the post-COVID syndrome. So a lot of patients who have suffered from COVID, irrespective if it was mild or severe, are showing symptoms like breathlessness, cough for a very long time. There have been cases wherein patients have developed symptoms of stroke, blackout, and cardiac diseases after they had COVID. The reason for this is the COVID SARS-CoV-2 virus attaches to something called as ACE2 receptors, which are present in all the organs of your body. So maybe if you had a mild COVID, right now you can have the expression of this same COVID virus as a post-COVID syndrome in any organ of the body. That is why post-COVID syndrome is a vast entity. A lot of people are still complaining of body ache, backache, and we are still not very sure as to when will we get complete recovery from this. On the mental front, what we are seeing is a lot of people have had what is now defined as post-traumatic stress syndrome, and restrictions that were brought around wherein you could not meet people, people have lost family members to COVID. A lot of people who are admitted in the ICU for a very long time are now facing difficulties like claustrophobia. There are certain issues related to children not going to school. So there's a lot of development, cognitive development, which is there with social mingling. So people are meant to meet each other, which did not happen for the past 2 years. So these physical and mental symptoms are there, and nobody is actually sure as to when will we recover from all of this. Covid-19 hit us somewhere around January 2020, but it was pretty evident from 2017 that air pollution is an epidemic, is a pandemic. There were a lot of research papers, a lot of studies that were carried out on the AQI levels around the various cities in India. So AQI is something which tells you how much the air is polluted around you. A good AQI is something which is below 50. Before the COVID pandemic, we had these AQI monitors, we had these white lungs installed in different parts of the country, and what we saw that the AQI levels never came down below 150. Then the pandemic came, there was a Janta curfew, there were absolutely no vehicles around, but the AQI still remained above 100. That is when we realized that the pollution is not only because of the vehicles, but there's a lot of ambient air pollution. There are certain factories, coal factories, which are releasing this soot and particulate matter, which comes to you because air has absolutely no compartment. And WHO has already stated in 2016 that 1/4 of deaths related to the heart, liver, brain and lungs are caused due to air pollution. So air pollution is the biggest threat that we have around us right now. It can be indoor air pollution, it can be outdoor air pollution, and COVID has just distracted us from this very big problem, which now we need to address as soon as possible. Silicosis is a disease. Lung silicosis is something which is very well defined, very well understood. So a lot of people who are working in certain segments, people who have these occupational hazards when they are working with shipbuilding industries or people who are working in coal mines and all, these are the ones who are exposed to something like silica, asbestos and coal. So silicosis is something wherein very fine particulate matter of silica tends to collect inside your lung, and then it causes something what we call is fibrosis. So these are the parts of your lung which now have lost their elasticity, and there is no exchange of oxygen and carbon dioxide happening. So these are the outcomes that we see because of occupational hazards such as coal worker pneumoconiosis, silicosis. And right now there have been a lot of changes which have been brought when it comes to safety of people who are working in such hazardous places. But then I think so there's still a long way to go before we can actually protect everyone who's working in these environment.